Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm interviewing Casey Hein. Thanks for being with me today, Casey.
Hey, Vanessa, did I ever tell you have the most beautiful, perfect smile?
Well, thank you very much for that. Now, Casey is a visionary behind the real-life application of periodontal research and a pioneer in building dental-medical collaboration. She speaks on a wide range of topics in this area, and for the purpose of this interview, we're going to be targeting her course, which is called Targeting Obesity in Dental Patients. So as I was thinking about this course, Casey, I wondered, and I was hoping you could start us out here. I was wondering, what is the typically we start with what's the problem, pain, or the challenge? What's happening in the dental practice that this course would help resolve? Could you help us connect it to the dental professional?
I think the biggest issue here is just the prevalence of overweight and obesity. It's been estimated that by 2030, about 1.2 billion people are going to be obese worldwide. And there's been so many calls to action by various authorities that suggest that all healthcare providers need to be involved in this epidemic. And I don't think that oral healthcare providers, dentists and dental hygienists and dental assistants, I don't think that exempts us. And what's fascinating, though, is how it truly does affect our patients, and that we have an increasing amount of solid evidence that suggests that periodontal disease and obesity and metabolic syndrome are interrelated here. It's fascinating research, and it's what's implicated in this is insulin resistance and in the pre-diabetic state. So increasingly, I think we need to be involved. And one of the key things I like to talk about here is that obesity is a state of general overall inflammation. It's an inflammatory condition. And so many of our patients, even before we look in their mouths, just look at their body type. And when they come in the door, it's not even necessary to talk about body mass index, but are they apple shaped and instead of pear shaped, and identifying people who may have metabolic syndrome or who may be kind of thick around the middle, a large waist circumference, because these are people who are inflammatory primed. The question we need to be asking ourselves in dentistry is what will periodontal disease in their mouth, the addition of it, how will that affect them? And so my hypothesis is that the trajectory of disease in periodontal disease in their mouths is going to be very different than the healthy person that's not inflammatory primed. So it's a wonderful opportunity, another for oral healthcare providers to be involved in overall health.
Very much so. I love that idea. So I'm assuming then, and I'd love to ask you more about what in depth, what do you cover in the course, but I'm assuming then that part of this is being able to have a conversation with our patients, and it sounds like that might be kind of a sticky conversation.
Oh, it is. It actually really is. I actually just gave a course last week online about this. And I took a poll and asked how many of you would start that conversation. And it was split. I guess there were about 500 people that attended this program online, and it was about equally split. Some said no way, and others said, yeah, it's time. And several people gave recommendations on how they would begin that conversation. It's a tough conversation. And actually, I've conducted workshops in this area so that practicing role-playing with one another on how this could work. And it's wonderful. It's really wonderful.
I love that it's a workshop and that people have the chance to work with it, for you to demonstrate and for them to try this new skill on. That's fabulous. What other topics do you cover in this course? What else will we learn?
Well, all my courses, I I take great pains to back up what I say with evidence, solid evidence. So we talk about the evidence that is related to this relationship between obesity, metabolic syndrome, and periodontal disease, starting as far back as 1977 when they were rat studies, but nonetheless it was a hallmark kind of research, and that it established that bacteria alone wasn't significant enough. It was just the addition of obesity to bacteria actually increased the risk for periodontal disease. So fascinating stuff. And there's been a ton of research in this area, not just in dentistry, but also in medical literature. So increasingly, physicians and nurses are actually in tune to this. So, and they want to know, what do we do with this person who walks in, who's 45 years old, he has a thick waist circumference, a family history of diabetes or cardiovascular disease. He's obese. What do we do? What do we do to collaborate with our colleagues in dentistry? So it's a great area, controversial, I will say, but increasingly, I think it's an exciting challenge for oral health care providers to pick this science up and run with it.
Oh, absolutely. It's a very exciting area. So your typical attendee, doctor, hygienist, clinical team, full team?
All of them. In fact, all of them. In fact, I recommend this as a program for the whole office, including the business people, the front desk people. And and all my courses are like that. And the reason I feel so strongly about it is I try to distill this science so that it's not dumbing it down by any stretch of the imagination. What it is explaining it in such a way that everybody, lay people, understand this. And so it's really it's important to understand the science behind all this. And so I think it's really important to engage the whole office, because it really does speak to philosophy of practice, excuse me, which is so important that everybody be on the same page. So it's mutually reinforcing. People at the front desk are reinforcing that whole message. So I think it's important not to leave them out of this.
Fabulous. Now, is this a half-day course, full day, couple hours? And what's the target?
Yeah, we can tailor this, but I would suggest a 2 to 3 hour course, half-day program would be great.
Awesome. And one more question on this. Is there another course that you offer that it would pair well with?
Absolutely. It is in diabetes and empowering oral health care providers to work with patients who have diabetes or pre-diabetes. And this is a super, super important course, especially with some of the new ADA codes that have come out that have to do with chairside testing for HbA1c, and also the gingivitis code. That's important. And we just know that how important it is. Today, there's 300 million people in the world that have diabetes, and that number is expected to go up because it's also tied to obesity. And so what's so important is that patients who have diabetes, whether it's been diagnosed or it's undiagnosed, they do have specialized needs. We cannot treat them the same way that we treat the healthy patient. So it's important that we understand the difference here, and it really does make a difference. And also, I believe that oral health care providers who are really, really in tune with this can help patients who are pre-diabetic jump that curve. So it's not inevitable. It's not inevitable that if you're pre-diabetic, that will develop into diabetes. And I think to be able to jump in front of that bus is something that we have the opportunity to do. And it's exciting. It's exciting to be involved in that and in our relationship with diabetes educators. So,
that is exciting.
Yeah, and jointly reinforcing our messages. So for instance, teaching diabetes educators about periodontal health and how it's related to increased risk for diabetes, and also complications of metabolic control, etc. And if they can talk to their patients about that, we can be mutually reinforcing the ABCs of diabetic control. And so this whole medical dental collaboration in this area is really important. When is it appropriate for us to contact the endocrinologist or the primary care physician who's treating this patient for diabetes, and what kind of outcomes and clinical endpoints, what kind of data is important, what kind of correspondence is important, what kind of education is important. So and it works great with a course on diabetes.
Well, I love your passion for it. It's really clear that both of these topics are ones you're very you find to be very important, and I agree with you, and I love your passion for it. So
thank you.
So I think we're going to need to wrap it up. Before we go, just like maybe a one-line bottom line. Is there anything you'd want the meeting planner to know about your obesity course that we perhaps haven't covered yet?
Overall, these courses, I've been in this particular genre now for many, many years, and increasingly what I hear is from dentists and hygienists is, thank you for reinvigorating me. And I think this whole idea of periodontal systemic health is perhaps the greatest opportunity we've ever had as oral health care providers to really step up and expand what we're thinking and expand our care of patients. And certainly, excuse me, certainly it is a huge practice builder when we practice excellence like this. Increasingly, we see research that suggests that patients say, bring it. We really like this. We really like that you're talking to us about our risk for cardiovascular disease. We really like the fact that you're asking us about our most recent HbA1c record. And the other evidence is that physicians like that we're doing this, that we're involved, So this whole area of interprofessional collaboration coming full tilt, and honestly, periodontal systemic medicine is the holy grail for that. And finally, to bridge medicine and dentistry, that schism that happened so many years ago. So it's an exciting time for us, and I believe we have to embrace this, or we will have lost a great opportunity to define ourselves in the healing arts.
Awesome. Well, Casey, thank you so much for being with us here today. And for more information on Casey Hein's presentations, visit dentalspeakersbureau.com, where you'll find her listed amongst our members. You'll find her contact information there, or feel free to reach out to me at info@dentalspeakersbureau.com, and I'd be happy to connect you. So thanks again for watching and tuning in, and Casey, for sharing your knowledge with us today.
Thank you. Thank you so much, Vanessa.
You're welcome. And until next time, be well.